Welcome back to the Physio Bros. Today we're talking about everything you need to know if you have back pain.
Did you know that 80% of the population will experience lower back pain at some point in their life? And at any given point in time, up to 30% of the population are actually experiencing back pain. So today we're going to show you 5 back facts that you need to know so you can understand your back better and recover faster. So let's do it.
The first thing you need to know is that persistent back pain can be scary, but rarely is it dangerous. Did you know that less than 1% of back pain is seen as a serious condition that would require medical intervention? Now we know persistent back pain is scary, but rarely is it associated with serious tissue damage. Even if you've had an injury to your back, most of them will heal within 3 months, like other tissues in your body. So if you have had an injury to your lower back, just know that the tissue of your back will heal well within a 3-month period. So if your pain is persisting past that point, then it's important to acknowledge that there may be other variables impacting your pain. They can be a multitude of things, whether it's fear of movement, your beliefs on how your back should heal, sleep, stress, and your recovery expectations. Now, the most common back pain that we see is pain that has come on over time, that's progressively worsened, that's associated with everyday activities, despite there being no injury or trauma. Now, this is associated with very real triggers of pain, whether that's poor sleep, fatigue, stress, inactivity, or performing activities that you're not accustomed to that can trigger this onset of back pain, which ultimately makes the muscles sensitive to loading. Now, if you have an acute onset of lower back pain and you say yes to any of these symptoms, then it's important that you go see a doctor. Do you have any changes in sensation to your saddle region, whether it's your genitals or bottom? Have you noticed any incontinence, whether it's bladder or fecal? Or have you noticed any power loss or changes in sensation in your lower limb? Then it's really important that you go seek medical advice. If you've said no to that criteria, then fantastic, you're going to benefit from knowing more about your back so that you can understand and get yourself moving without pain.
Our second point is that getting older is not a cause of your back pain. Don't believe that wear and tear is a cause of your pain. As we get older, it's this common belief that you'll have to put up with back pain and dealing with back pain is just an inevitability of life. However, what we know is this is not supported in the research whatsoever, and we really want to make sure that no matter what age you're at, it's never too late to get started in managing your own back pain. We often hear people saying that I've done my back in, I've got a crook back, I've lifted too much when I was younger, or I've done this and that has led to me having this ongoing pain. However, we know that our backs don't wear out from everyday activities such as bending, turning, twisting, and it's actually one of, if not, the strongest structure in the body. A lot of the time when people have pain, they begin to immediately adjust what they're doing and they stop doing the things that they love, and then over time, your back pain actually worsens as a result of stopping doing these things that you and your back love doing. Getting back to your normal loading throughout the day, such as your bending, twisting, and turning movements, and being able to do them smoothly, and slowly increasing the amount that you do each day, will get you back to doing the things that you love and will slowly improve your back.
The next back fact is back pain is not from poor posture or a weak core. How we sit, stand, or bend throughout the day is not going to be the cause of your back pain, even if you do experience some pain with these activities. It's important to find ways to help relax while you're doing these activities. So feel free to sit slouched, slunched, and rounded in the chair. As long as you're comfortable, that's the important thing. Most of the time when treating back pain, I find it helpful to remind people it's not about how you sit, it's the length of time that you're sitting for. I encourage you to try and move regularly. So to do that, what I want you to do is set an alarm every 40 to 50 minutes as a reminder for you to stand up and change the position that you've been in for that length of period of time. Even if it's just a 10-meter walk away from your desk, just to interrupt the static posture that you're in for that time. Just as an example for you to think about, imagine trying to hold your arm in a position for an hour or a couple hours, and then when you go to move it next, it's stiff and sore after being on for that whole time. Of course it makes sense. Movement is the answer, so what we want you to do is break up that sedentary time. That's really going to help deal with the stiffness and pain of your lower back. The other point is weak core is not the cause of your pain. In actual fact, most commonly people come in to see us and they have such an overactive, tight core and they have difficulty with switching it off, which can be one of the causes for their pain, as they're bracing the whole time. Don't get me wrong, being strong is extremely helpful when you go to lift something and do activities. But if you have difficulty with switching off those muscles, that's when it can be a problem. So learning to relax your core may actually be the answer for treating your pain and getting you back to doing the everyday activities that you love to do pain-free.
Our next point is an awesome point that we really want you to know, and that's the question, does pain necessarily have to mean tissue damage? And the fast answer to that is absolutely not. We know that having pain doesn't mean that there's any tissue damage present in your back. When pain persists, especially over a period of time, it's really common for your back and its surrounding structures to have sensitivity both to touch and to movement. The pain you feel during these activities and movements will reflect how sensitive the structures, muscles, and tissues are around your back, not how damaged they are. It is safe and normal for you to feel pain when you start moving again and start performing exercise. Start returning to doing small walks and gradually build up the activity that you can do over time so that you can return to those everyday activities. There is not one particular exercise that for you that will cure your back. Just know that. It's just about finding something that works for you and that you can enjoy that will consistently get you moving again. Remember, after having an acute flare-up of back pain, doing nothing and stopping moving is the opposite of what your back needs. Remember, our backs are designed for movement and they love to move. So after getting a new onset of back pain, it's really important about training your body to get comfortable with these movements again. As you get more comfortable, your structures that we were talking about before will get less and less sensitive, then you'll be able to move more, and then the sensitivity will keep reducing, and over time then you'll get back to full movement and be able to do whatever you want. It's all about training our movement patterns of our back and starting small and slowly building up. Now, if you are in the situation of having a new onset of back pain or a flare in your back pain at all, this can be really scary, as we've mentioned before, but it's rarely a result of you actually doing something wrong. A lot of the time, it's actually dependent on your situation as well. You might have financial, familial, friends, or work stresses in your day-to-day life. If you think about the work situation in particular, the more stressed you are at work, it's usually meaning you're going to be working for longer hours, which will then mean that you're sitting in a sedentary position for longer, which will mean you're exercising less, and usually you're going to have worse sleep and recovery as a result of that. The more sedentary you are and the less activity you're doing, your back structures are going to get more sensitive and sore over time as you're moving less. So it's a really important reminder to consider your circumstances around your pain as well. And trying to acknowledge and control these factors can be a really essential key in managing your back pain.
Now, the last back fact that you need to be aware of is that scans, surgery, injections, and strong medication is rarely going to be the cure for your back pain. We know that from an abundance of evidence that strong drug use, surgeries, and spinal injections are not conducive in treating persistent back pain. So we know that there are much more effective ways to treat your persistent back pain which have less harmful side effects. And that is understanding how your back works, which hopefully we've achieved today, and getting you moving comfortably again. Now, the other thing I mentioned was medical imaging or scans. This is rarely going to be helpful in diagnosing or treating someone's back pain. Most of the time, scan results actually drive fear because they've got scary terms like disc herniation, protrusion, arthritis, degenerative changes. What they don't say is those scan results are actually quite normal. And in actual fact, we see that quite a lot in healthy populations, people that don't report pain at all. This has actually been well researched. We know people over the age of 60 who have no back pain whatsoever. About 90% of that population will present with medical imaging or scans that show degenerative changes. And this is in a healthy, pain-free population. To further that point, this study also highlighted people between the age group of 30 to 39. In 50% of that patient population, they noticed that there were some signs of degenerative changes already on these scans, but yet these people had no pain at all. So this study tells us that despite there being some changes in your back, it's not always a bad thing. In fact, it's very normal and it doesn't indicate what is driving your pain most of the time. We also know that scans or medical imaging do not predict the severity of your symptoms, nor will they tell us how disabling your symptoms will be. We know that scans often change, and things like disc protrusions naturally heal over time. So if you already have a scan that shows degeneration or disc protrusions, just know this is a part of aging. The same way as we age, we can't do anything about your hair color going grey, you can't do anything about your wrinkles coming along, and these changes aren't associated with pain. It's the exact same thing with your back. It just shows that you've lived a good life.
Well, that's it, guys. That's our 5 back facts. We really hope you found them useful. We've left some really good resources in the description. There's a video about chronic pain, and then there's also 10 myths about back pain that we'd love to share with you, so go check them out.
Please remember to like, comment, and subscribe, and we'll see you next time.